Thank you everyone for coming here, and we're just trying to put vital information out there, and like we said yesterday, and Dr. Whalen said, as the tests slow up, the numbers are going to slow up, but we're still trying to put good stuff out there, what's going on. And I was talking to somebody yesterday, I go, look, we went from the Brady Bunch to the Osborns. I go, that's the new norm that we're in now, and life has changed. And we have to get used to the things that are changed around us and take a deep breath. And we're all going to be good because we're all good county residents. Everyone loves living in this county. I love representing this county. And we can do that by helping out one another. And I know everyone's anxiety's up. I know people are, kind of like wondering with too much information, too much load on the internet. I want to say this again to your viewers, please, and the people that are watching this live on Facebook, stop reading Facebook. Stop believing everything that you see there. It's not true. If there's a cure, trust me, the main doctors are going to be out in front telling you. If someone's trying to sell you a product and telling you it's a good product and will stop it, don't believe it. Don't waste your money. And let's be the good Albany County residents that we are in this capital district and take care of one another, and that's what it's about. So I do, again, want to commend our Department of Health, as always, and Dr. Whalen, who sleeps less than I have been lately and is going around the clock for her and her staff, and Governor Cuomo, who's been a great leader on this, not just on our state level, but on a national level. As of today, we're up to 122 cases, confirmed positive cases. We're up to 490 people under mandatory quarantine. That's up from 318 yesterday. That number changed, obviously, because of the more cases and the great job the Department of Health's doing mapping and tracing everyone. And then the mandatory or the unmandatory quarantine is still at the same 634, and that's going to change. That's a number, like, we don't want to just put any number out there. They have to continue to contact people and figure out where everyone was at. We have 7 people that are hospitalized now, putting the average up about 5.7%. And remember, when this all started March 2nd, we went from 2 cases to March 16 to 15 to yesterday 115, 122 today. Like we said, the testing's going to slow up. We need more test kits. We need the federal government to step up, get us the kits. I commend the governor again for getting for doing the testing that we did. But you're going to, it's here, people. The coronavirus is here. It's here. If you think you have symptoms of this, call your physician. But they're going to prioritize, like we said yesterday. They're going to prioritize who goes and who doesn't, who gets tested, because they're limited on cases. Again, I want to thank the good residents of Albany County that have been stepping up. When we talked yesterday about M and Bird and Watervliet donating the mask, we got such a huge response back from businesses and people that want to help out. Today, we're picking up donated masks, gowns, and other PPE equipment from the Gilliland School District. So I want to thank the Gilliland School District and the superintendent. They're donating 2,000 gloves, disinfectant wipes, about 250, and plus 250 surgical masks, bleach, disinfectant spray, and suits, and one box of gowns. I can't thank the Gilliland School District. They had this around. They knew they had this, and they're going to get it up so then we can get it over to the sheriff's EOC, and they can get it out to the people that need it. We need this to keep our healthcare workers safe. It's critical. People think about this. Think about the people that are going out there every day keeping government running, but the men and women on the front lines at our hospitals and around our police and fire and regular people just out there working. So keep that in mind. And again, I say this to everyone, take a deep breath, take a step back. We're going to be all right. We're going to get through this. We're going to get through this together as good New Yorkers. And the only way we're going to do this if we stay calm and take care of the people that might not be so calm, that need a little bit more help than anyone else. We talked about the mental health line that we established from day one, knowing that people are going to have anxiety, people are going to have issues, and the first hour we put that up, we had 11 calls right away, and a variety of questions that they have, or uneasiness in this new situation that we're in. So please, I'm going to put the number out there again. It's area code 518-269-6634. 518-269-6634, and it's available 7 days a week from 8 a.m. to 5. I can't help but to say to our mental health doctors that are doing this, thank you so much, Dr. Jean, everyone else. We also put a plea out about our nursing home, Shaker Place. and challenge the kids around Albany County and outside the county. I don't, they want to do it, about Albany County Kids Care at albanycounty.gov. And yesterday they all started coming in, and you see this little picture, and this little girl actually stood out to me the most. She said, after every storm comes a rainbow, and it's so true. After this storm, we'll have a rainbow, we'll sit back, and we'll talk about it, and it's awesome. And that's going to put so many smiles on so many residents' face. It actually put a nice smile on my face this morning when I was looking at it. We also put a letter out to all the superintendents about nurses they might have throughout the school districts that are sitting home, that don't work at hospitals, to step up and help out with our medical reserve corps. So that's out there. And listen, things got to continue to go on, right? We have a census count going on. We can't use the regular resources we're planning on, volunteers going out, obviously knocking on doors and getting the count. And why do I bring it up with all this going on? Life has to continue on, right? We have $1.5 trillion that are going to be affected if we don't get the right count. If you look just at the city of Albany situation, now with schools shut down, SUNY schools gone back home, the town of Colony's population will probably be bigger than the city of Albany this year. Why does that matter? Because it matters for the next 10 years, them federal dollars aren't going to come into the city of Albany, because all the students that went home that are normally here are gone. They won't be counted. They'll be counted back home. That's going to have a major impact on our economy going forward, services going forward, that alone, and take out what else is going on. But aid coming back to us for a lot of programs that we run in the city of Albany and throughout the county. So please do your job, get online, do your census. We need to keep that count going on and going forward. About 19% of Albany County households have already completed the census. We're actually above the New York rate of 16%. So we are doing good, but it's so important. And please don't forget about the New York State hotline, 1-888-364-3065, and the 211 number through United Way for any questions. One of the cases that Dr. Whalen talked about a little bit, and Sheriff Apple, we did have somebody, we addressed the issue. We had someone in the city mission that came down with COVID-19, and we've actually had plans in place for stuff like this. So we'll talk a little bit about that, but Dr. Whalen.
Thank you, County Executive McCoy. So as you see, since yesterday, we have 7 additional new cases that have been reported to us. And I anticipate this week that our numbers will seem to slightly drop off or stabilize. And again, the message to the public should not be reassurance that we're having less cases, but that this is reflective of the fact that the testing is not being done as widely as we previously had been doing. The testing now will be available to those that need hospitalization and hospital healthcare workers that have to be ruled out for their work. We continue to work with the hospitals and with all local health departments and the New York State Department of Health daily on messaging to the public, and there are some important messages that I share with you on a daily basis about the importance of staying home. I will continue to reassert this, and I believe one of the messages that I try to tell people is in order to contain this, you have to act like you have it and treat your family and treat others as if you have it. At the beginning of the outbreak of COVID-19 in the country, a message that you were hearing from a lot of healthcare providers and a lot of people in public health was that the asymptomatic patients are not necessarily the driver of infection. This was based on knowledge we have of many other viruses, but as we have continued to watch this emerge across the country and have learned more about it from an epidemiologic perspective, we know that that's no longer the case. That is not the case. There are individuals who are asymptomatic or have mild symptoms that are spreading this in the community. And that should make it more important for people to realize the importance of staying with, 6 feet is an important distance, and to stay at home if you're not an essential worker. All of us need to protect ourselves. All of us need to protect each other. This is essential going forward, so I will continue to reassert that. We are seeing cases in settings, sensitive settings, like the county executive mentioned this morning. We are working with agencies to make sure that individuals that have had close contact are maintained in a circumstance where they can be quarantined and won't put others at risk. This involves utilizing support from our DSS and other county agencies, and I'd like to thank Commissioner McClave, who's been very helpful on this, particularly in settings related to individuals that are homeless or in shelters. We know that these cases will continue. We know that we are going to continue to see cases, and the information that we relay to the public more and more every day is in keeping with what we are hearing across the state and across the country about the important message of social distance and staying home. We don't yet know what the timeline for this is going to be. But if we look at the way this has affected other areas, and we look at the information that we have over the last 2 weeks, I believe it's likely that we are entering a period where we are going to see more community spread. So that information should be shared widely and should be used to caution people. I do look at social media, but I have a lot of friends that are doctors on social media, so I sometimes get helpful messages when I look at social media. And one of the messages that I saw this morning that I thought would be helpful for people, the county health department, as you know, tracks all positive cases. We call everyone that has the diagnosis in Albany County of COVID-19, and our first question to them is, what were you doing for the last couple of weeks or before you became symptomatic? Tell us who you were in contact with. I would like everybody in the community to reflect on that. If I had to call you tomorrow to give you this diagnosis, my hope is that you would say, well, I heeded the message, so I really have not been in contact with anyone other than people that I may live with. And even in those situations, we try within our home to stay apart from each other to the extent possible. If you were to be asked that question tomorrow, what would you respond? Please think of this and let it guide your actions. We continue to look forward to working on this with everyone. This is a group effort, this is a community effort, and all of us need to work together to flatten this curve, to make sure that our hospitals are able to address the capacity issues that we believe they will be facing, and for all of us to be able to come out on the other side of this. Thank you.
Thank you, Doctor. Craig?
So we continue to ramp up supplies. We're getting a shipment in as I speak. They're offloading sanitizer and things, which we've made several hundred kits we've distributed to EMS, fire, police, some home health care workers, some funeral home parlors. We're getting inundated with requests. We're trying to keep up with them as quickly as possible. And again, we're asking people that please use the PPE cautiously, as far as some instances don't necessarily require it. We do have another case testing positive at the jail. We're isolating inmates and staff again. Fortunately or unfortunately, this morning is when some of our employees are getting out of quarantine, so now we'll be replacing them with other employees. We continue to disinfect buildings. The one incident as far as the homeless shelter that we're trying to work out is, as you know, for the last couple of months, we've been working on a homeless program at the county jail. The wing is ready to go. We're working on staffing issues today, tomorrow. As I was walking over here, I was on the phone with Hattis. We have a company that obviously has laid off their workers, and they're looking to help out. So we're hopeful that maybe within the next 3 to 5 days we can get that open. If anybody wants to take a peek at it, you're more than welcome. It's an incredible feat that our staff has put together up there. So other than that, we're going to continue to answer our calls, and again, just trying to keep people apart. A lot of folks, I think, still think this is a hoax and are not taking us serious. But I can't stress enough, if we all just do this for a few weeks, I think we can get through this. So please just obey the guidelines and the protocols that are out there.